Good morning. Serving as Kentucky's Attorney General is the honor of my lifetime. I love this job because every morning when I go to it, I don't feel like I'm going to do a job or to go to work. I feel like I'm going to serve a mission. Our mission in the Attorney General's office is pretty simple. We believe every Kentucky family deserves to live in a safe neighborhood and have a real path to prosperity. But what is a safe neighborhood? It's not only a neighborhood free from violence, Chief, it's a neighborhood, as you know, free from drugs. The opioid epidemic and our addiction crisis is the challenge of our times. It's the greatest challenge to the lives of our people here in Kentucky. Every single day in Kentucky, we lose 4 Kentuckians, friends, family members, and neighbors to a fatal overdose. We'll lose 4 Kentuckians today. But it's also the single greatest threat to our families. It is ripping apart our families at the seams. We have more children living in foster care and kinship care than ever before that have either lost a parent who has lost their life or has lost a parent because drugs have taken away their ability to parent. And those children are going to suffer from that trauma for their entire lives. And it's our single greatest threat to job growth here in Kentucky. To recruiting and building the types of jobs that we want our kids and our kids' kids to be able to hold. Anywhere you go in Kentucky right now, employers will tell you that their single greatest challenge is finding enough skilled workers that can pass that drug test week after week after week. So I mean it when I say that this drug epidemic is the single greatest challenge we face as a Commonwealth. And you see it all across the country. It permeates our news, both local and national. And we see it right here in Kentucky, right here in Lexington. Many of you all know about 8 months ago in downtown Lexington on a Thursday at 3 in the afternoon, one of our investigators and I pulled an overdosing man from a car. It was right on Broadway, right in front of the Opera House. I watched that individual lying in the middle of the street in traffic turn from his normal color to blue to purple, and they'll tell you the next color is dead. He stopped breathing for several minutes, and as we prepared to do CPR, our wonderful police officers in Lexington showed up, used the Narcan, and were able to revive him. But that's what we're facing. An individual driving a car, I believe, using carfentanil at 3 o'clock in the afternoon on a Thursday in downtown Lexington. Lives are being lost. Children are losing parents, and parents are losing their children. We all know someone that we've lost. It's reached the point where every Kentuckian knows someone that they've lost, someone that they love, and we all have someone that we're worried about losing next. It's the root of so many crimes, whether it's domestic violence, theft, child abuse, scams, or even human trafficking. My office is working to address this epidemic on a number of fronts. On the law enforcement side, we work on a DEA task force to chase the worst of the worst fentanyl and carfentanil dealers. Our Eastern Kentucky Appalachian HIDTA task force continues to pursue rogue doctors and pharmacies that would flood our communities with illicit prescription pills. We're hosting drug forums all across this Commonwealth to continue to raise awareness. We're pushing for common sense legislation that supports law enforcement and directs funding to treatment, recovery, and education. And we've already provided over $8 million of settlement funds to 15 drug treatment centers all across Kentucky. And we see with our hardworking groups like the Hope Center and others what just a little bit of seed funding can do, how many more that they can help. And we provided $2 million to a rocket docket to get those who are using but not selling drugs out of the court system and into treatment as quickly as possible. We're also working to hold those multi-billion-dollar drug companies responsible for some of the damage that they have caused. We have national distributors and manufacturers that we believe have knowingly flooded our communities with pills that they knew were addictive, but marketed them as otherwise. And while they made their billions, our communities suffered. Your Attorney General's office doesn't believe in punishment. We believe in accountability and responsibility. And that's the basis for each and every one of these suits that we have filed. And we're working with other states to press insurers to adopt financial incentives for prioritizing non-opioid means of pain management. But we know one of the most important things that we can do to help prevent addiction in the next generation is to safely dispose of unused prescription medication. The Journal of American Medicine estimates that 80% of people using heroin right now became addicted through prescription pills. And that's pretty profound. What it tells us is for 80% of people who are using heroin right now, they didn't make a decision to buy a street-level drug until they were already actively addicted. And for 70% of the people out there abusing prescription pills, they're not their pills. They're from a friend or a family member. It tells us the most dangerous place in each and every one of our homes, the most likely place to cause addiction with our kids and our grandkids, is the medicine cabinet. But for so many parents, I remember when I became a parent, when you go through your house to try to make it as safe as possible for your children, you put the plugs in the outlets, you anchor the furniture, but so many parents don't clean out that medicine cabinet. That's why we launched the Kentucky Opioid Disposal Program last year, a pilot program in 4 counties aimed at cleaning out each and every one of the medicine cabinets in that community. We provided 10,000 of these pouches each to 4 Kentucky counties, Perry, Floyd, McCracken, and Henderson, in an effort to try to make each and every one of those homes safe and to allow families to make a real impact on this opioid epidemic in the less than a minute it takes to use them. And we launched this program because as we looked around, we asked the question, if you want to get rid of that medication, if you want to make your home safe, how do you do it? And at that time, hospitals wouldn't take them back. Pharmacies wouldn't take them back. And while we appreciate the drop boxes at our police and sheriff's office, there are folks who have transportation issues or maybe don't want to be seen putting their prescription pills in that bin. That's why I'm so excited about the announcement here today, because one of our largest national pharmacies is bucking the trend. They are taking responsibility and allowing the return of unused prescription medication at the same place that their customers come to get their new prescriptions. CVS is joining my office and other attorney generals across the country in helping to clean out our medicine cabinets. They understand the scope of the opioid epidemic and are stepping up to do their part to stem the tide. For far too long, there were limited options on how you could return your prescription medicine. But thanks to CVS, thanks to this first initiative, which I hope is a first initiative, CVS is making disposing of unused prescription medication so much easier. They have opened 9 of the kiosks you see here today throughout the state, and we certainly hope they will install many more. This is a true step in the right direction. It means every single person who comes into this facility has a safe way of disposing of their unused prescription medications. It can be things like fentanyl strips, which we see abused on a daily basis, and we know how dangerous they are. It can be your unused prescription opioids after a surgery, after a hip replacement, when you end up with a significant amount. It's a safe place to drop it off if you've lost a loved one that in the end of their life had so many different prescription medications to help ease their transition. Today is a big day. It's a step in the right direction. And it's a step in responsibility. A corporate citizen stepping up, doing the right thing, and because of it, Kentucky citizens are going to be much better off. I appreciate CVS's commitment to their clients and to our community, and I'm proud to stand here with them today. I now get to introduce Thomas Moriarty, Chief Policy and External Affairs Officers from CVS, who's joining us today to tell us more about these nationwide efforts. Thomas, on behalf of the Commonwealth of Kentucky, thank you very much.
Thank you very much. Well, thank you all for being here. The opioid crisis, as the General has outlined, is a complicated problem that didn't begin overnight and won't be solved overnight. It started more than 20 years ago, and in the last 2 decades, opioid prescribing rates have tripled and deaths due to drug overdoses have reached approximately 60,000 annually. These are sobering statistics. A byproduct of the overprescribing of opioids is that these powerful medications are stocked up in medicine cabinets across this country, where they can be misused, abused, or diverted. Since 2014, we have been working with local law enforcement to provide opportunities for patients to safely dispose of unwanted medications at more than 850 police departments across the country. And through this effort, to date, we have collected and disposed of more than 140 metric tons. That's 300,000 pounds of unwanted medication from medicine cabinets.
All right.
Today, as the General indicated, we are expanding our drug disposal collection program with the addition of kiosks like this one at 750 of our retail pharmacies across the country. In Kentucky, we've added 9 in-store collection units to the additional units we've donated to police departments across the state. Our safe medication disposal program is just one, though, of the initiatives we've undertaken to help prevent opioid abuse and drug addiction in our communities. In another example, since 2015, CVS Health has operated a program that we call Pharmacists Teach. Through this program, our pharmacists speak to students at local schools about the dangers of abusing prescription drugs. Here in Kentucky, our pharmacists have reached nearly 3,000 students to date with the message that one choice can change everything in their lives. And as I arrived here today, I was told that just last week in Louisville at a high school, we did a program that covered 850 students. This commitment is real. It's our pharmacists who volunteer their time to go out into the communities and talk to the kids about the dangers of just one bad choice. To further combat this epidemic, we also, though, have worked to increase access to the overdose reversal drug naloxone, also known as Narcan, in 46 states and counting, including here in Kentucky. And we have invested hundreds of millions of dollars to conduct nearly 2.8 million hours of training with our pharmacy teams over the past 5 years to assure that we are in compliance with federal and state controlled substance laws and regulations. As a result of this work, over the last 5 years, we have seen a drop of nearly 30% in opioid dispensing in our pharmacies. We're proud of that result, but we know that it is not enough. That's why we recently announced additional steps to bolster our fight against this epidemic. We are limiting the supply of opioids dispensed to 7 days for our CVS Caremark patients with certain acute conditions, following a dental procedure, an ankle sprain, and who are new to opioid therapy. This aligns with the limits on opioid dispensing set by the country's foremost authorities and public health experts at the Centers for Disease Control. And in so many tragic stories of opioid abuse and misuse, we hear that patients didn't know or understand how powerful and addictive these medications can be. To address this, our pharmacists have further strengthened our counseling with patients about the risk of dependence and addiction tied to opioid use, the importance of keeping medications secure in the home, and, most importantly, the methods of proper disposal of unused medications. Our efforts to help address the opioid epidemic are rooted in our focus in the communities that we serve and making that commitment locally. The opioid epidemic has no single cause, and as we all know, it doesn't discriminate. It exists in our cities, in the suburbs, and across rural America. Without a doubt, it will require a multi-pronged effort involving many healthcare stakeholders. We are very proud to be working here in Kentucky and across the country with leaders like those that you see here today who are making a meaningful impact on this epidemic. Now, I'm pleased to introduce our next speaker, Lexington Police Chief Weathers. Chief? Thank you.
Thank you all for coming out, and I just want you to know that this is truly historic. To have a large corporation such as CVS take an active interest in their local communities. That's fabulous, sir, and I applaud you and CVS for doing that. I'm a big proponent of prevention education, treatment, intervention, and education. CVS is hitting on all of those cylinders. Providing this drop box will provide wonders in the area of prevention. Partnering with law enforcement by providing the boxes to the Lexington Police Department and the sheriff, that's amazing. I mean, look at the tons of medication that we're taking in our downtown locations, and now having boxes out and more accessible to people in the community means that more lives are going to be saved, that less access to some of these opioids that are destroying or adversely affecting our community and destroying lives. That's amazing. Educating our young people, educating their customers on the dangers and effects of these type of drugs. You can't ask for anything more. Providing naloxone, Narcan for some of our people that are already affected, that's a true commitment to the community. Those are the kind of people that we need doing business here in Fayette County. So on behalf of the mayor, on behalf of the Commissioner of Public Safety and all our public safety partners, thank you very much, CVS.
I'm Sharon Tankersley, and I'm the Director of Voices of Hope. We are a recovery support group here in Lexington, and we're honored to be a part of this here today, taking part in this notable event. I would momentarily, before I turn my comments toward the box and the occasion, like to take a moment to recognize a few of my slightly younger colleagues. I have the privilege of working with some of the UK College of Pharmacy students on a 3-year service learning project, and this seemed like the perfect opportunity for them to come out and support the future of their field. CVS is leading the way, and we are training these young people in Fayette County to become part of that community-based solution for the future. So I wanted to recognize them. And I also would like to give my thanks and respect to the Attorney General and his staff, and thanks for inviting us here, as well as the leadership of CVS Health. For both entities, for both offices, always seeking to provide innovative community-based strategies in response to this public health crisis. Safe storage and disposal of medications, as we know, is a proven strategy to protect our families in this community and others from harm. It is a simple way, kind of a no-brainer of a way for citizens in every home in this community to be part of the solution to this problem. And so we at Voices of Hope take every chance to be part of these cross-sector collaborations, these efforts where we see government and corporate America and nonprofits and the private sector, the families and individuals in the homes across our state to come together to be part of addressing the needs of those that are impacted by this epidemic. And so we are honored, as I said, to be part of this moment where we're officially launching the use of this box in this community, and hopefully many more to come after. Thank you.
Good morning. On behalf of the 77th Legislative House District, I bring you greetings this morning. Thank you to CVS and to Attorney General Beshear, Freudian slip.
We can't answer questions on that.
It is a pleasure to be here to announce this great initiative that will deal with the opioid crisis in our community and the issues and concerns that affect so many, and being able to, in terms of treatment and in terms of intervention, be able to provide a method for eliminating and downgrading the opioids and dangerous medications that may be in our file cabinets at home and that may be in our home that we can't get rid of and we don't know how to get rid of. This will give us an opportunity to expedite that. And thank you to the young people. It is critically important that you all step forward and that you all are stepping forward to make sure that your peers understand how difficult this problem is. It's easy to get in, but so very hard to get out. So want to make sure that as you all are ambassadors for what is concerned, for what we're concerned with, is that you talk to your friends about not going down that rabbit hole. Okay? Thank you all very much. Thank you for being here. We appreciate you. Thank you.
Have anybody else? Well, you know, when we announced our Kentucky opioid disposal program, I talked about hope coming in a 1-pound pouch. Today, we have a little more hope coming in a very heavy drop box. But now that we are working and CVS has stepped up to really create access to safely dispose of prescription medications, it is on us to push the responsibility of each and every Kentuckian to use these options, whether it's the pouch or the drop box. Let's make sure that we clean out each and every medicine cabinet in each and every home throughout Kentucky. So we'll take questions now on this program, and then afterwards I'm happy to answer any other questions outside, but I think we owe it to CVS for some of the other things that may be going around in Kentucky to answer those separately. Anybody? We were that clear? All right, thank you very much.